Hi, I'm Brittany Wilburn, and I'm the Executive Director at the Health Partnership, an organization committed to compassionately connecting individuals to health and well-being resources so they thrive. One of our key programs is our recovery program, and we host clean and sober events across Routt and Moffat counties, working with individuals struggling with or in recovery from substance use disorders.
And I'm Lindsay Simbay. I work at the Colorado Consortium for Prescription Drug Abuse Prevention. I grew up in Steamboat Springs, Colorado, and continue to live and work here while supporting 16 counties in the northwest corner of the state with the work that they're doing to address the opioid crisis.
We're here today to provide some education about fentanyl.
Fentanyl is a synthetic opioid 80 to 100 times stronger than morphine and 50 times stronger than heroin. It is both prescribed and illicit. Illicit fentanyl is cheap and relatively easy to manufacture. It's often blended with other substances and sold as counterfeit pills, but can also be blended into powders and crystalline substances. It is tasteless, colorless, and odorless, so it is very difficult to detect. When prescribed, it's often in a patch or lollipop form and used for patients who have terminal illnesses and are experiencing a lot of pain. It's also given in the emergency department or labor and delivery for acute pain. Many people also receive fentanyl during or after surgery in the hospital.
Illicit fentanyl is often mass-produced in China and then shipped to Mexico, where the cartels blend it with other substances to create counterfeit pills that can look like OxyContin, Xanax, or Adderall. It can also be found in powder form and can be mixed with substances like cocaine or methamphetamines. Because there is no quality control in the illicit market, different pills and blended substances can contain wildly different quantities of fentanyl. Additionally, in pills, the fentanyl is often unevenly distributed throughout, so a portion of the pill could contain enough fentanyl to cause an overdose, while the other half could contain none. The varying potency of fentanyl makes it difficult to use safely, even for individuals who are experienced with using opioids.
You may have also heard about rainbow fentanyl in the news. Rainbow fentanyl refers to counterfeit pills and powders that come in different colors. From what we know, this is not done in an attempt to attract youth. Different suppliers are using the coloring to differentiate their product. It does not mean that Halloween candy or other types of candy are contaminated with fentanyl, despite what the media may lead you to believe. We've seen a few cases of rainbow fentanyl locally, and with a large tourist population in the Yampa Valley, it's good to be aware of what else is out there.
In 2019 in Colorado, 222 people died of a fentanyl overdose. That more than doubled in 2020, with 540 overdose deaths attributed to fentanyl. In 2021, the fentanyl overdose deaths increased to 912, almost doubling again. In 2022, there were 920 deaths attributed to fentanyl, and the number is increasing again in 2023. So, what can you do? Download the Opioid Rescue app, recognize the signs of a potential overdose, carry naloxone, also known as Narcan or Cloxato, learn how to administer naloxone, talk to your friends, your neighbors, and your children about fentanyl and how to reverse an opioid overdose. And you can head over to thehealthpartnership.org to learn more.